The World Health Organization reports that tuberculosis virus is the 13th leading source of death globally and the second leading infectious killer after COVID-19. The World Health Organization estimates that in 2020, nearly 10 million people worldwide developed TB and 1.5 million people died from the disease, including 214,000 people who also had HIV. A majority of the people affected were in Asia. However, TB remains a matter of concern in many other areas, including the United States. The same year, doctors reported 7,174 cases of TB in the US, and that's coming in from the Centers for Disease Control and Prevention. Currently, antibiotic resistance is causing renewed concerns about TB among experts. Some strains of the disease are not responding to the most effective treatment options. In this case, TB becomes difficult to treat. Hello and welcome to the Spotlight in Food and Health Communications, your number one go-to source for credible and timely health information. Victor Wabari is my name. On today's episode of the program, we will be focused on the spotlight on the tuberculosis disease. We will take a very quick break now. When we come back, the conversation begins. Please do not stray. Welcome back. What is tuberculosis? Tuberculosis is an infectious disease that usually affects the lungs. Though it can affect any organ in the body, it can be developed when bacteria spreads through droplets in the air. TB can be fatal, but in many cases, it is preventable and treatable. When it comes to TB infection, there are two types of it. Number one, the latent TB infection, and number two, the active TB infection. Let's start off with the latent TB. An individual can have TB bacteria in their body and never develop symptoms. In most people, the immune system can, contain the bacteria so that they do not replicate the cause disease. In this case, a person will have TB infection but not active disease. Doctors refer to these as latent TB. An individual may, never experience symptoms and be unaware that they have the infection. There is also no risk of passing on a latent infection to someone else. However, a person with latent TB still requires treatment. The CDC estimates that as many as 13 million people in the United States have latent TB. And now let's go to the active TB. The body may be unable to contain TB bacteria. This is more common when the immune system is weakened due to illness or the use of certain medications. When this happens, the bacteria can replicate and cause symptoms resulting in active TB. People with active TB can spread the infection. Now, without medical intervention, TB becomes active in 5 to 10% of people with the infection, and according to the CDC, progression occurs within 2 to 5 years in about 50% of these people. Now, the risk of developing active TB is higher in number one, anyone with a weakened immune system. Number two, anyone who first, develops the infection in the past 2 to 5 years. Number three, older adults and young children. Number four, people who inject recreational drugs. Number five, people who have not previously received appropriate treatment for TB. The next question is, what are the symptoms of tuberculosis? Let's start off with the latent TB and see, the symptoms that are attributed to the latent TB. A person with latent TB will have no symptoms and no damage will show on a chest X-ray. However, a blood test or a skin prick test will indicate that they have TB infection. Active TB. An individual with TB disease may experience a cough that produces phlegms, fatigue, a fever, chills, and a loss of appetite and weight. Symptoms can typically worsen over time, but then they can also spontaneously go away and return. What are the early warnings and signs that you should be mindful of? Now, a person should see a doctor if they, have a persistent cough lasting at least 3 weeks, if they have a phlegm which may have blood on it, when they cough, a loss of appetite and weight, a general feeling of fatigue and being unwell, swelling in the neck, a fever, night sweats, chest pains beyond the lungs. If you have the signs, you just need to see a doctor as fast as you can. TB usually affects the lungs, though symptoms can develop in other parts of the body. This is actually more common in people with weakened immune systems. And it is important that you know that the TB viruses can cause some of those things I'm about to say now. It can cause persistently swollen lymph nodes or swollen glands. It can also cause abdominal pain. It can also cause joint or bone pain. It can sometimes cause confusion and a persistent headache. Some persons go ahead to experience seizures. If you have some of the signs and symptoms, these are some of the things you can actually experience, and you need to see your doctor as fast as possible. The next question you might be asking, okay, now I know the signs and I know the symptoms. What is the diagnosis for TB? A person with latent TB will have no symptoms, but the infection can show up on test. Now, people should ask for a TB test if they, number one, have spent time with someone who has or is at a risk of TB. If you have friends and families, relations who have, contacted the disease or been tested positive to the TB virus, then you need to be wary. If you have spent time with them, you need to be wary of having the disease. Number two, if you have spent time in a country with high rates of tuberculosis. Number three, if you have worked in an environment where TB may be present. A doctor will, ask about any symptoms and the person's medical history. They will also perform a physical examination which involves listening to the lungs and checking for swelling in the lymph nodes. Two tests can show whether TB bacteria are present. Number one, the TB skin test, and number two, the TB blood test. However, these cannot indicate whether TB is active or latent. To test for active TB disease, the doctor may recommend, a sputum test and a chest x-ray. However, with TB needs treatment, regardless of whether the infection is active or, latent. Now, what are the treatments for TB? With early detection and appropriate antibiotics, TB is treatable, so there is no cause for alarm. If you have contacted the disease, if you have the disease, you don't have to be weary, you don't have to be scared, it is actually treatable. The right type of antibiotic and length of treatment will depend on, number one, the person's age and overall health. Number two, whether, they have had latent or active TB. Number three, the location of the infection. Number four, whether the strain of TB is drug resistant. Now, treatment for latent TB can actually vary. It may involve someone taking an antibiotic once a week for 12 weeks or every day for 9 months. Treatment for active TB may involve taking several drugs for 6 to 9 months. When a person has a drug-resistant strains of TB, the treatment will be actually more complex. Now, it is essential for people to complete the full course of treatment even if symptoms go away, and that's something quite a lot of people struggle with. If they begin to take their drugs, their medications, and then they realize that the symptoms is no longer there, they quit the drug. That is something you should drastically avoid if you are treating tuberculosis, because the treatment can actually become drug resistant. Sometimes we had Dr. Omachi on a program, the Straight Talk program, and he really talked about that. If you followed up on that program, how that certain drugs can become drug resistant, and it is very, very harmful to tuberculosis patients. If a person stops taking their medications early, some bacteria can survive and become drug resistant, can become antibiotic resistant. In this case, the person may go on to develop drug resistant TB. Now, depending on the parts of the body that the TB affects, a doctor may also prescribe, number one, the causes. M. tuberculosis bacteria cause TB. That's what causes TB. The M. tuberculosis bacteria. They can actually spread through the air in droplets when a person with pulmonary TB coughs, sneezes, spits, coughs, or talks. Only people with active TB can transmit the infection. However, Most individuals with the disease can no longer transmit the bacteria after receiving appropriate treatment for at least 2 weeks. So if you have the disease and you've been on medications for about 2 weeks, you can actually no longer transmit the disease. What's all the prevention? Remember, it said that prevention is better than cure. You're watching right now and you're saying, I do not have tuberculosis. I don't have tuberculosis as a disease in my body. The big question you should be asking yourself is this: how do I prevent myself? Now, ways of preventing the TB from infecting yourself and others include: number 1, getting a diagnosis and treatment early. Number 2, staying away from other people until there is no longer a risk of infection. Number 3, wearing a mask, covering the mouth and ventilating rooms. Now, as we try to round off on the show, we will take a very quick break. When we come back, the summary takes place and we wind down on the conversation. Please do not stray. Welcome back. This is still the Spotlight on Food and Health Communications, your number one go-to media source for credible and timely health information. My name is Victor Waberi. We have been focusing the spotlight on the tuberculosis disease. And as we try to wind down on the show this morning, it is very important that you know that an active TB infection is contagious and potentially life-threatening if a person does not receive appropriate treatment. However, most cases are treatable, especially when doctors detect them early. Anyone with a high risk of developing TB or any symptoms of the disease should consult a doctor as soon as possible. TB is a reportable disease to each state's Department of Health. State-sanctioned regulations and treatment plans can provide care for patients regardless of immigration status, insurance coverage, or socio-economic status. And this is where we'll let down the anchors on the show today. It has been an interesting journey with you, my friend, on the Spotlight. Till I come your way next time, please kindly subscribe to our YouTube channel and check out our videos. We have enriching health content that are needful for your health life. And do not forget, you can also check us out on www.foodandhealth.com. And do well to like those videos. And if you have thoughts and contributions, questions and comments, do well to leave them in the comment section below, and we will do well to reach out to you. Till I come your way next time, keep staying healthy. Victor Waberi is my name. Bye for now.